For Chapter 7, we're going to be covering amphetamines. Amphetamines is the last type of stimulant that we're going to be covering for this part of the course or this exam 2. So the one thing to know about amphetamines is that they are synthetic. So these are lab-created chemical structures that we basically made. And specifically, amphetamines were discovered early on to treat attention deficit hyperactivity disorder, known as ADHD, and still today, the types of drugs that cover that type of diagnosis or that reduce the symptoms of ADHD are basically a type of amphetamine. Typically, these are not exactly the same structure as like the street drugs such as meth, so they are different. So in this case, they're methyl Ritalin or Concerta or some of those other medications that are commonly used for ADHD. They are very effective, which leaves us, appreciating the use of the therapeutic approach of amphetamines. However, because they are very effective, these are also drugs that are actually also misused. So besides having issues with abuse of meth and some of the other street drugs made from similar amphetamine synthetic drugs, the misuse, illicit use of prescribed amphetamines, or in this case like Ritalin and some of those other Adderall medications, is also another problem. So this is what we called drug diversion. So in this case, you're basically using a prescribed medication for recreational use, and often this recreational use is not by the person who it gets prescribed to. Now, methamphetamine is one of the types of drugs that you probably have heard of quite a bit. So methamphetamine is often known as meth, simple, ice, crystal meth is another name. So this is a pretty common street drug that is pretty heavily abused, and still we kind of are in a place where we can consider it to be a social problem, because there are a high number of individuals that are unfortunately addicted to meth. And the problem with meth, though, is that it is also a very deteriorating drug. So the abuse potential is super high, so people can become addicted to it pretty quickly, and the deterioration of the person is pretty fast too, which is also part of the problem. So cathinons is a amphetamine-like structure also, so it's a type of amphetamine. However, this component, there is a natural ingredient out in nature, which comes from a plant called cat, and that would be this right here. Cat is a type of leaf that comes from a plant that is not native to the North or South America. It's actually only native to East Africa and some of the kind of Arab peninsulas. And in this cat, there is basically what we know as the natural kind of cathinon. So it's very similar to amphetamines, and kind of similar to those coca leaves in South America. Cat leaves do actually get chewed just in those same areas. Now, the thing with this is, though, that cat has not become quite of a problem in comparison to, I guess, cocaine leaves and coca leaves. Is one of the reasons is because it has to be fresh. So in order for cat to have that stimulant cathinon that's actually active and that will act as a psychoactive chemical, it needs to be fairly fresh. So if transporting the leaves all over to the US would probably not be very effective, as most of these leaves would lose their freshness, and that's one of the reasons why it really hasn't become an issue. So basically, I think I've said this in the past, but for most drugs that we have a psychoactive reaction to, so like especially drugs that are synthetic, usually there's going to be something that's very similar in nature. So in this case, cat is that. So it's kind of like the real version of the amphetamines, but amphetamines are all created in the lab, so they're synthetic. Now, so amphetamines, again, this is a type of drug that has been synthesized, so it was created. It was created in 1887, so it's been a while since it was created, more than 100 years. But it didn't really become something that was explored until much later, so it took a couple of 30 years for it to actually start to be explored more and to see if it could be a treatment for something. So at first they were trying to figure out if they could use it as a treatment for asthma, and then eventually they figured out that it might have been a treatment for narcolepsy. It's still in that phase, so we still use it for some of the narcoleptic medications out there. And the second thing is that they thought that it might help with depression. Now today, though, we do know that we don't actually use any amphetamines in depressive medications because it's not actually doing anything to the depression in itself. It's just giving people highs, and with that comes all the abuse potential. So we no longer use it in that sense. Now, the other thing that's kind of interesting about amphetamines is that in the 40s, so during World War II, it was kind of commonly prescribed to people, to veterans or to military, as a way for them to continue to maintain their alertness and continue to stay awake. So it was said that would help them focus and become sort of better soldiers in a way. Now, this did create an issue, which we probably don't talk about very much in the history books, but it did generate a population of veterans who were basically addicted to methamphetamines, or a type of this. And then coming back, it was kind of a problem for them too. So the production of meth had basically two stories. So first, it was dominated by organized crime. So much in the same way that cocaine and marijuana and some of those other illicit drugs or illegal drugs was kind of navigated by big criminal groups. The same thing happened to meth. So meth was being smuggled in from California, Mexico. There's these routes that were all over the place, definitely Texas. If you Google probably meth in Texas, usually once a month or once every couple months, there's like a meth bust in most of these states, including Texas. Now, it wasn't until the 90s, though, that kind of dynamic shifted, and we started to see more homegrown meth labs. So more of the actual creation of it in little towns and rural areas versus the actual transport from other places. It just basically became cheaper to do that, specifically because a lot of the chemicals needed to create meth are pretty accessible. So they were obtained in pharmacies or through different kind of venues. So, for example, some of the fertilizers that are used for a lot of these rural areas contain things such as like the ammonia or anhydrous ammonia, ether. A lot of these things are chemicals that are used with various groups, including like the agricultural fields. Also, ephedrine and pseudoephedrine is also the main ingredient in a lot of cold medicine. Some of you might remember that about, I think, 10 years, maybe about 8 years ago or 6 years ago, all these NyQuil and all these other medications were kind of shifted to the back of the register. So you had to sign in order to get these cold medications with Sudafed and things like that. Well, the reason behind that was precisely the rise of meth and meth labs in the U.S. So what they were finding was that people were basically just going in and buying all this medication and then were creating meth with it. Now, aside from just the notion of creating more meth to be distributed and abused and becoming a social issue, the thing is that meth labs created huge risks. So there was risks of fire, explosions, and then there was a lot of toxic waste. So they use a lot of these harsh chemicals, again, ether, which is basically a type of fuel, and some of the other ammonia kind of chemicals that by the end of the creation of the meth, there was a lot of this stuff that was very toxic that needed to be disposed of. So sometimes you would find little rivers and small little towns containing a lot of this that can potentially get into the water system and other issues like that. Explosions, kids being exposed to a lot of these things or being hurt by being in the proximity of a meth lab was also pretty common. Here's some pictures. This is unfortunately some of the victims of the meth situation. Was not just the individuals that were addicts, but also the kids being hurt in the outcome. So here are some common signs. Often there was burnt, there was this kind of lack of hair. Usually in these little kids also kind of test positive for meth, so it kind of gets into their system just by being around it. And just to give you an example of how much toxic waste there is, about 5 pounds of waste is produced for every 1 pound of meth. So that's quite substantial. That's a lot of toxic stuff going somewhere, and often, again, people would kind of dump it into rivers or such. Routes of administration are greatly going to impact the intensity and how long the drug effect impacts a person. We have oral administration, which is definitely still the slowest. As we mentioned, it takes usually about 30 minutes to an hour for it to onset the action. It can even take up to 4 hours for there to be an impact. Usually oral administration of amphetamines is also a lot less. So that's why more individuals that are addicted to things such as like meth, they don't necessarily take it orally. They use other methods because it takes so much longer to, again, achieve that high. Basically does not give them the strong impact than if they were to take it by inhaling it or intranasally or injecting it, which is also a common form of taking some of these amphetamines in. So in terms of distribution, it is a drug that easily crosses the blood-brain barrier and the placenta barrier. So it just goes right in there and becomes, starts to do all the activation and all the maneuvering. In this case, some of the concentration that it impacts is in the spleen, kidneys, and the brain. So these are areas where it kind of tends to kind of gravitate towards. But again, all these drugs are going to reach most of your body in general. Now, in terms of excretion, the liver is a huge player in this case. About 60% of it gets metabolized there. So if we look at the structure of amphetamines, they are very remarkably similar to two of our main neurotransmitters. In this case, it's dopamine and norepinephrine. So if you can see the shape here, this atomic structure. Here's the norepinephrine. There is a similarity. So they have the same kind of like hydrogen makeup here. So therefore, they impact these systems. So they're specifically what they do is that they really produce a heightened action in terms of the monoamine transmitter. So if you remember, the monoamines are dopamine, norepinephrine, serotonin. And these three specifically are highly impacted by the presence of amphetamines. And one of the things that it does is that basically the taking of the meth or the different types of amphetamines creates this leaking. So if you remember, we have our presynaptic neuron and our postsynaptic neuron, and then all these neurotransmitters are carried in the vesicles. Okay, vesicles are just like the little sac-like structures that carry dopamine, serotonin. They carry it all right here. Now, usually these sac-like structures, the vesicles, they kind of travel through the neuron and they bind to the edge of the presynaptic neuron. Then they release all the dopamine, serotonin, all the stuff. Amphetamines do is that they basically kind of rupture the vesicles and they make these neurotransmitters leak a lot faster. So then what you're having is this kind of rush and greater presence of dopamine and norepinephrine specifically in the synaptic cleft, so in the synapse. And then there's a lot of activation. So it just kind of like leaks and goes and activates substantially. And that in and of itself is kind of the biggest impact of amphetamines on the synaptic cleft. Now, the other thing that they do besides this, besides leaking the vesicles and creating more an increased amount of neurotransmitters in that potential and then having more of the action potential happen, so it kind of speeds everything up, it stimulates your neurotransmission, is that they also block the reuptake. So one of the ways that the extra neurotransmitters that don't activate taken care of in a sense is that they go and they get recycled back into the presynaptic neuron. So the reuptake system puts them back into here and then they don't have the same chance of activating the neuron again. Amphetamines block that. So not only are they leaking, creating the atmosphere for the vesicles to leak, but they also are blocking the reuptake. So they're, again, creating a scenario where there's so much dopamine and so much norepinephrine, and there's just so much activation because the presence of them is just very substantial. So this is basically what creates that intensity and that stimulation of the system. It results, again, in a prolonged duration, and then the intensity is so quick because all these mechanisms are kind of messed with. So overall, the activity basically increases. It increases, again, because it promotes just more of our natural monoamine neurotransmitters in the synapse. Now, in short-term effects, it creates that high. So it gets people the high, the increased mood, the less appetite, all those symptoms. Now, long-term effect, though, this is one of the drugs that will change your chemical structure of your brain. And what it will do is it will basically promote a downregulation. In this case, what it's doing, body knows, okay, there's way too much dopamine. What is going on? Why are we being activated so much? So what it does is that it basically starts to produce less dopamine and less norepinephrine. So it just says, okay, there's too much, let's stop producing it. Because for some reason, all this activity is really heightened. So that is what we call downregulation. Your brain says pause the production, slow it down where there's way too much. The unfortunate thing though is that sometimes this can be kind of permanent. So even if people stop using or abusing meth, then what they are left with now is less than normal natural dopamine and serotonin, which is then linked to a lot of things such as like depression, sleep issues, and things like that. So all the opposite of what having too much dopamine was creating. And these effects are sometimes permanent. So it really depends. There's data out there that says that there is some recovery from the brain. So the brain will, once people stop using, let's just call it meth for now, usually at least a year or two later, you can see some recovery of the brain. So the brain starts to slowly develop more and more monoamine neurotransmitters. It starts to kind of try to go back to normal. Meth is a very, very erodive kind of drug that really damages a lot of your brain structure. Specifically, the areas that tend to be quite impacted are, again, memory. We talked about that, the emotion area, and also our reward system. So again, what you get left with is this brain that in a way is kind of not this brain that has had some decay, and that some of the damage that can be potentially pretty permanent, specifically in the emotions and the memory. Often people who have recovered from meth addictions will report things as, continued maybe having issues with mood disorders, or just having an overarching kind of different experience with emotions, and also a harder time with memory. In terms of effects, you can kind of separate these into either moderate dosages, so it depends again on the dosage, or high dosages. So in terms of low and moderate dosages, and often those first-time users, the impact is very kind of fight or flight response. So there's this increased heart rate, blood pressure, respiratory. They kind of feel like the body temperature increases, and specifically there's a lot of appetite suppression. So they don't necessarily feel like they're hungry. And if you remember, all this is on purpose, right? So if we're activating our flight or fight response, then our body is getting ready to escape or survive. In those times when we're trying to survive or escape, we're not going to be worried about eating because we're just trying to get out of danger. So a lot of the things that our body does, again, it's just a form of survival. Some of the behavioral effects are, again, mood elevation. So people usually report higher mood, more talkativeness, usually more likely to want to engage in social interactions. There's usually this grandiose feeling, high alertness, typically report not feeling very bored, and there's usually a high sense of insomnia. So there's like no need to sleep, basically. At a face value, these seem kind of great. Like you're kind of rested, going up, ready to take on the world. And so a lot of kind of positive things. And some even report some higher physical endurance. So they feel like they can do more things. So these are all kind of very attractive effects. But unfortunately, these are specifically the things that also have created this meth problem, where we have a lot of individuals who are addicted to the substance. In terms of performance, there seems to be kind of mixed. So there is an increased attention. So there is sort of like maybe like a higher ability to focus on specific things. But because there's that heightened arousal and that kind of increased heart rate, increased kind of like let's get going kind of feeling, usually there's more errors. So it's almost like you're more focused but also more reckless in a way. Now in high dosages, the effects, especially short-term effects, can be quite intense to the point of creating what we call a stimulant-induced psychosis. So psychosis is basically the presence of either delusions or hallucinations. And in this case, for amphetamines, or specifically for meth, it can create both the hallucinations and delusions. So delusions, so that is like seeing objects, hearing voices, things like that. Now, the other thing is that it can create this thing we called punding. Punding is basically just a random behavior that becomes repetitive. So it kind of becomes like a tic. And in high dosages, and the psychosis kind of, or meth-induced psychosis, it's very common. If you look at these different symptoms, and you know a little bit about abnormal psychology, you could probably recall that these are the same symptoms that resemble schizophrenia. So in a way, it kind of creates a psychotic episode that would be very similar to some of the individuals that have schizophrenia. For most people, this will disappear within a few hours. Now, if you can imagine, it can be very distressing, especially if you have things like formication. So formication is the feeling of bugs or like creatures either crawling on your skin or under your skin. If some of you remember the movie The Mummy, where there's that one guy who like is stealing the little bugs that look like jewels, but then they crawl under his skin. So that is a type of formication. Formication is very distressing for people because, again, it's basically the combination of a hallucination with also a little bit of a delusion. So they feel like they're being attacked by bugs, like these bugs are going to, I don't know, kill them or something, and they actually see them and feel them. So the long-term effects of meth specifically are pretty drastic. They can really go from impacting a person very, very substantially in terms of how well they are as individuals. So if you kind of think about the symptoms, so meth, it makes you feel kind of grandeur. There's a lot of energy, so there's a lot of moving around, doing things. But there also, it decreases your appetite. So people aren't stopping to eat, and they're actually using a lot of energy. And it also decreases sleep, which is very much needed in a healthy lifestyle. So in a sense, it's kind of like the perfect storm to really create a very unwell type of experience. So people who have been using meth for a while usually deteriorate in their physical health very substantially. They often lose weight. They might also have like dental issues. I mean, if you're not eating, you're also not getting nutrients. And if you're not getting nutrients, you're probably, a lot of things are happening, like your hair gets brittle, your teeth might decalcify. So there's a lot of things that happen once you start to have a very unhealthy lifestyle. And all that is kind of the perfect storm for it to really deteriorate a person. Meth mouth is a common thing also. So this is kind of the actual impact of meth in your mouth, and it kind of deteriorates like the teeth, it darkens them, it weakens them. Secondly is that often with long-term use comes almost like shifts in personality, where you tend to see people become a lot more violent and a lot more unpredictable and just a lot more, again, unhealthy or unreasonable in their life choices. So their personality might shift in ways that might also isolate them more, which is also problematic for people who are then trying to get better or maybe avoid using it. If we can imagine a person who then gets rejected by individuals will probably feel pretty bad about themselves and would want to resort to those same venues of using meth to feel better. So it's kind of like this cycle that can be very, very hard to. So the thing with meth that is a little different than cocaine is that you can go on meth runs. So this is when individuals use amphetamines continuously for hours or even days, even weeks at a time. Now, usually, again, the idea here is to remain in that high, to remain feeling the effect of the meth, and to not go back to feeling worse, because sometimes when there are these highs, then the result of that is kind of this opposite reaction where you now have the crash. And the crash is basically feeling worse than when you started. So it's having the depression, for cocaine, there's also cocaine crash. In that case, we call it the cocaine blues. And often that looks like the mood kind of dips, and it dips past normality. So the other fact that sometimes we forget is that actually a methamphetamine, unlike some of the other drugs, does increase libido. So it's people's sex drive pretty substantially, and more so than other drugs. Now, tolerance. So tolerance is a little bit similar to cocaine in a way that it basically you have this acute tolerance that happens. So just like cocaine, the first hit is going to be the strongest, and it's going to cause the biggest euphoria, the biggest mood boosters. Once that hit happens, even if they're going on a meth run, the next ones coming up don't quite give individuals that same effect. So often what you have is them taking more of it in order for them to feel what they're wanting to feel. Chronic tolerance is a little bit different than acute tolerance. So acute tolerance is what happens right away. Chronic tolerance is something that kind of changes as you continue to use a drug. In this case, appetite suppression usually starts to disappear. So if a person is going on a run where they're using a lot of methamphetamines, let's just say for a few weeks, usually it will suppress their hunger pretty substantially initially, but then it will start to disappear and slowly kind of go back to normal past the week or two after they're repeatedly using it. This is probably a good thing, again, because you can't really survive on not eating for more than 2 weeks. So this tolerance effect, this chronic type, is again probably more of a survival mechanism. Lethal effects also show substantial tolerance. So individuals who use methamphetamines very substantially, especially for a long time, will be able to take extremely high dosages and still not necessarily have an overdose. So with sensitization is that basically it's the opposite of tolerance. So in this case, there's less drug needed to achieve a certain reaction. For some reasons, what we do observe is that individuals that use a lot, sometimes the longer that they use the meth, the more likely they are to then start to continue to have more and more psychosis or psychotic behaviors. All right, so be sure to read over withdrawal and extinction. Those are 2 things that we will be talking about, and also the treatment of amphetamine. In terms of the medication that we use for ADHD, the impact that ADHD medication has on the brain is that it increases dopamine. That's the purpose. It just increases dopamine, but it does it in a way that is slow and steady. So it's not like meth where you have a huge surge of dopamine in the synapse. It does it more intentionally, and then the effect then is usually twofold: to improve attention and kind of decrease distractibility. So they're able to kind of fine-tune their attention and stimulate maybe their attention span to specific things. And then at the same time, it also kind of lessens the noise. The second thing that is hypothesized that ADHD medication does is that it basically increases motivation. There, just like the other amphetamines, there is some side effects that especially kids have when they are using medication for attention deficit disorder, or even adults who use it too, which is that often these kids have a harder time sleeping, again very similar to meth use, and they also lose appetite, and with that comes a lot of weight loss. So in the past, I've worked with individuals that take this medication, and one of the things that we definitely monitor with kids that are on ADHD medication, their weight, because often they do lose quite a substantial amount of weight. Now, if you're also not eating, lacking nutrients a little bit, and not sleeping, then one of the other side effects that happens is that their growth gets delayed. Now, most of this growth delay isn't permanent, so it's not like people are becoming shorter than they would have been. What it does is just slows down the process. So most growth for kids does happen when they're sleeping. It's a necessary component of growing. So therefore, when you're not doing those things, then the growth process is just kind of prolonged. The drug holiday, and the drug holiday is usually kind of a term that is used to describe kids being off their meds when they're not in school. So when they're maybe during Christmas break, fall break, or the summer break, sometimes parents will, for one reason or another, not give them their medication. So often during the summer, then you'll have these kids having these huge growth spurts because they're not taking that medication and it's not delaying their growth. Right, so be sure to cover the rest of the chapter. I did not cover everything, and exam 2 will be coming up.